Hello, I'm Melissa Trudinger, and I'm one of the writers at the APA's In Motion magazine, and I'm here with Trudy Rebbeck, who is one of the physios who was inducted last night as an honoured member of the APA. Trudy, how are you?
Oh, great, thank you. Such an honour to be here.
That's great. Tell me a little bit about yourself. You weren't always planning to become a physiotherapist, were you?
Well, actually, when I had the choice as a young person in a school, like many young people out there, I had the choice to be either a physiotherapist or a medicine or a doctor. I got accepted into both programs at the same time. And I think I consciously chose physiotherapy, as I told you last night, because the three main reasons. I think I had an inherent belief in physical health above medical health. Mm-hmm. I was an athlete at the time, might be hard to imagine now, but I was a netballer, and it was physiotherapists that got me back onto the court. And I just loved the way they interacted, and it sounded to me like it would be a profession that would have more in-person time with their patients, and it ended up being so.
So you decided to go and study physiotherapy, and you worked in the clinic for many years, correct?
Yeah.
Yeah. How's the clinical work that you've done informed your research work?
Well, so I'm in the clinical area, so now as a clinical specialist, so I guess the road from that early career through to clinical specialisation was one of my career pathways. But along that road, as a young physio, it became apparent to me that people with neck injury and head injury or concussion were put back on the field against our, I guess, better judgment, and that would often be made by a coach or it would be made by an administrator of the sporting team. And I just thought, if I don't do anything about this, it's just going to stay the same. So I can either just be a physio that has no say, or I can be one that undertakes research that shows what better practice is like. And so I think it was my patients that I was standing up for, who had neck injury, who had concussion, and it was also the profession. Like, we can do this better, and so we need to prove it.
Right. So you moved into research alongside your clinical work to start with?
Yeah, so I'm still a clinician, so I'm still a specialist clinician and still work in that field. So in traumatic neck injury, concussion, headache, dizziness, so I still work in that. And then concurrently do the research career.
Is it hard to balance the two?
Yeah, it's always hard. You always feel you're failing at one or the other. But I think for me it's important because the patient care informs the research questions, and likewise, being a researcher means you can implement the latest research into practice straight away. So that's important too.
Mentoring others in the physiotherapy profession is an important part of your career.
Yeah.
Why is that so important to you?
The why is that as one person, you're just going to affect the people directly under your care. But if you can teach others, and I'm lucky enough to teach both clinicians. So as I mentioned yesterday, I teach across the spectrum of physiotherapy, so from undergraduate through to early career, right through to specialisation. So I get to influence what they're doing from when they start, but also when they're at the top end of their practice, ensuring that's at high end as well. And it's by teaching others, then you obviously reach more people. You reach more people that care.
What advice would you give to a physiotherapist who is contemplating moving into some research activities?
There'll be something that ignites young physiotherapists' interest, and as it did me. And it might be a patient problem that you see that isn't solved by the evidence. Like you've done everything that the evidence-based management says and they didn't get better. And then you have a question about that, and you might want to know more about it. And it's that inquiring mind, that curious mind, I think, that is the person that wants to then go out on and do research and find out more about it. So, if you're curious or inquiring about something, I would say, stick to your guns and seek some help around you, seek some mentors, seek some supervisors, and then go for it, because you never know what you're capable of.
You were named an APA honoured member last night.
Yes.
Congratulations for that. What does it mean to you to be recognised in this way?
That means a lot. It's probably it's the highlight of my career in a way, to be recognised by your profession for what you've done. And this is a profession I love and have loved for many years. The amount of years we can keep out of the interview, but I've just loved being every minute of being part of this profession. And I guess that's driven me, to prove what physiotherapy does is worthwhile, to teach our profession to be at top of scope. And so to be recognised that for all of those things, for the advocacy, for the clinical work, for the research work, was just amazing. You never expect that, and I certainly didn't expect it. But yeah, I think it's one of my career highlights for sure.
What else would you consider a career highlight?
Maybe that depends on the stage as well. So I think when you see. Obviously, when you set yourself an aim and there's an end to it. So one of those is specialisation, for example. When I undertook that process and then obviously passed and became a specialist, that was fairly significant at that time. Obtaining your PhD, obviously, that's a lot of work, 7 years of work. So that's a career highlight. I think I never expected to academically go through to professor. I never anticipated I'd do that. I only ever wanted to research for my patients and for clinicians. But, I was encouraged by my mentors to do that, to say, well, people want you to lead. People want you to do that. You're doing it anyway. You might as well, go for professor. And so I was only awarded professorship a couple of years ago, but I never expected to do that. But that was a highlight as well, I think, because now you think, well, now I really do have to teach everyone else.
And from a research perspective, what are you most proud of?
I am really proud of the pathways of care that we currently undertake. And that's a combination of trying to get the right care to the right people at the right time. It's a commonly used term, but we try to work out who needs the more simple and the easier care and who needs much more complex care. And in the field of musculoskeletal health, and how do we get that to them in a way that's sustainable and equitable and scalable, utilising different models, so utilising some virtual care, telehealth, some in-person care. And so I have a great team of researchers with me that share that same vision. I'm really proud of that they put their faith and trust in me to lead that. And we have a whole heap of clinicians who translate that, who actually do that on the ground with patients, and they put their faith in me too. And I just feel so proud of them, and if I'm allowed to be, but of their dedication, that at a clinician level, they're taking time out to be the best they can be as well, So I think the fact that they all put their faith in me makes me enormously proud. Yeah.
That's great. Well, thank you very much for having a chat, and congratulations once again on your award.
Oh, thank you for having me.
Yeah.